Gastroesophageal reflux disease is one of the most common disorders. Typical symptoms are heartburn and regurgitation of stomach contents up into the back of the throat. But it's not just burning pain and a sour taste in your mouth. It causes millions of doctor visits every year, millions of hospitalizations, and the most feared complication is cancer. You start out with a normal esophagus, and if the acid keeps creeping up, it gets all inflamed, and you can get esophagitis, which can turn into Barrett's esophagus, which can turn into cancer, adenocarcinoma. To prevent all that, we just need to prevent the acid reflux in the first place. In the last 3 decades, the incidence of this cancer in the U.S. has increased 6-fold, an increase greater than that of melanoma, breast, or prostate cancer, and that's because acid reflux is on the rise. In the United States, we're up to like 1 in 4 people suffering at least weekly heartburn and/or acid regurgitation, compared to down around 5% in Asia, suggesting dietary factors may play a role. In general, high fat intake is associated with increased risk, whereas high fiber foods appear to be protective. The reasons fat intake may be associated with GERD symptoms and erosive esophagitis is because studies on volunteers have shown that when we eat fatty foods, the sphincter at the top of the stomach that's supposed to keep the food down and the acid down is relaxed in the presence of fat, and so more acid can creep up into the esophagus. For example, if you have volunteers eat a high-fat meal, a McDonald's sausage and egg McMuffin, and compare that to a low-fat meal, McDonald's hotcakes, there was significantly more acid squirted up in the esophagus after the high-fat meal.